22 degrees, 421 here at NewsTalk 1400 DWS. Pleased to begin a new monthly segment here today with Dr. Scott Paluska from Oak Orthopedics. We'll be talking about all sorts of injury information about pain, and we do have an email address set up where folks can email questions to us about any of those topics. That's ortho@WDWS, ortho@WDWS.com. And Dr. Paluska joining me on the phone this afternoon. How are you today, Scott?
I'm doing great, thank you.
I figured it'd be good to start off in the middle of basketball season to kind of talk about the sport and maybe some of the different challenges it can present from an injury standpoint. Folks of all ages play the game of basketball, of course, and it can lead to a lot of different injuries. Thought we'd start off by talking about maybe things at the youth level, junior high, high school age kids, and some of the things that can happen to young kids when they really start playing the game for the first time on a regular basis.
I think one of the interesting things about younger people is that they often have a bit of weakness where the tendons connect onto the bones. And so there's certain places where maybe you've got a 13-year-old who's grown 2 or 3 inches in the last year or two, and maybe their tendons only grew half of that. And so they end up with this extra tension where tendons and bones come together. And they can get these issues which go by different people's names, and some people have heard of Osgood-Schlatters disease or Seaver's disease. But essentially, these are problems that are overuse injuries at a bone-tendon connection. And so younger athletes, particularly basketball players who may do more jumping, have a problem right below their kneecap, kind of on their lower leg where you feel that bump sticking out in the front. So 2 or 3 inches below the kneecap, that connection area where the tendon and bone comes together, the Osgood-Schlatters problem, can be one source of front-of-the-knee pain in younger basketball players.
And I'm curious, Scott, with younger players, do you notice different types of injuries maybe between boys and girls, or do they tend to have a lot of the same types of issues?
I think they're similar because both are playing at fairly high levels at younger ages these days. But with that said, there are certain injury patterns that may occur more frequently in one gender versus the other. For instance, ACL tears are probably 7 to 10 times more likely to occur in a female athlete than a male athlete. And some of that has changed as more gender-specific coaching has come online here, where instead of trying to teach girls to play like boys, we're teaching girls to play like girls at a very competitive level. But they still have increased risks of tearing certain ligaments in the knee. The ankles are probably similar. Obviously, ankle sprains are going to be a very common injury that both boy and girl basketball players would experience.
For parents or grandparents who have a youngster who's playing basketball here this year, what are some things they should look for with their young athlete? Maybe some indications that there might be some sort of an issue?
I think they should pay attention to pain that seems to be getting worse at lower levels of activity. So if it used to bother the athlete a bit afterwards, and now it's bothering it earlier and earlier during the practice or the game, then that's probably something to pay attention to. The other thing I worry about is if an athlete is normally a very active, aggressive player and they're asking to be taken out. They want to be on the bench, they want to skip practices, they're not interested in doing that extra tournament. That's usually some indication that there's something going on that's causing them to feel more and more apprehensive or concerned about how they're feeling. And those are kind of maybe a little bit more of a red flag that should prompt evaluation.
Dr. Scott Paluska from Oak Orthopedics, my guest this afternoon, talking about the sport of basketball and some of the injury problems it can present in certain situations. Dr. Paluska, on the other end of things, older guys like myself who still fancy themselves basketball players, maybe just taking part in the local rec league. What are some things that guys, maybe 35 and up need to kind of watch out for when it comes to basketball?
One of the things I think you need to watch out for is the fact that you're probably 10 or 20 years past a point at which maybe you were playing very competitively before. And many folks get right out on the court, don't do much warm-up. Their conditioning may be a little bit off because you're busy with work and travel and kids and all that. And you go out and play at 110%. So rule number one is a good warm-up. Rule number two for me is make sure you have at least some adequate baseline conditioning. So if you're going to play basketball, for instance, your heart and lungs and joints are ready to put up with that 45 or 90-minute exercise episode. But once you've done all that stuff, the bigger risk that you start to face is that your parts are a little less elastic as you age. You start to lose some of the water in the tendons, and the soft tissues tend to tear more than they stretch. So, for instance, many times you'll see a 45-year-old basketball player running down the court, and they they feel a pop behind their ankle, and they turn around to see who kicked them or who threw a rock at them, and they've ruptured their Achilles tendon. So at that age, you're likely to tear a tendon or possibly a ligament in the knee a bit more easily than you would have 5 or 10 years earlier.
And again, just some indications maybe that something might be bothering you and you should ease off a little bit.
Yeah, and I think that maybe you're going to be able to recognize more mechanical problems. So if you feel like a joint like the knee or the ankle is locking up or getting caught or really isn't functioning well in its planes of motion, meaning bending up and down in different directions, then that's important. Upper extremity-wise, maybe if you're feeling like things are more unstable, your shoulder is a little bit loose, you're worried about dislocating it, and every time you go up for that slam dunk that I know you're doing on the weekends there, Brian, you feel like, boy, that shoulder just shifts in and out a little more than I like. So it's maybe a bit more awareness of the joints not moving like they're supposed to, or you're apprehensive that something is about to happen, meaning you got a partial injury just waiting to go all the way through. Those would be things to pay attention to.
All right, Dr. Scott Paluska, my guest this afternoon, and you mentioned for girls in particular that one of the more common injuries is an ACL tear, but you also see that on the men's side, and I think basketball fans familiar with Derrick Rose with the Bulls. He's going through a rehab from an ACL tear that occurred last spring. Having gone through one of those rehabs myself, I know it's not a lot of fun, but for folks who maybe aren't familiar with it, Dr. Paluska, just give them an idea of kind of the timeline that an elite athlete like Derrick Rose might be going through to try and get back out on the court.
Realistically, it takes a minimum of 3 months after an ACL surgery before you're doing many things at a normal level comfortably. That means walking and climbing and getting in and out of your vehicles. For most people, 6 months is the time at which you're cleared to participate fully. But realistically, it can take 9 to 12 months before an elite athlete can return to play at a high level. With that said, not all elite athletes can get back to where they were, even with the best case scenario of surgery and recovery and really treating it with a lot of respect. It's unfortunately less common to have an absolute complete recovery to the performance that they were used to before the injury.
All right, so we'll keep an eye on Derrick as he makes his comeback. He's supposed to be back sometime this spring for the Chicago Bulls. Dr. Scott Paluska with me this afternoon. If you have any questions for the doctor, we'll be doing this the second Monday of each month. You can email your questions to ortho@WDWS.com, ortho@WDWS.com. And Dr. Paluska, if folks have any questions about maybe some pain or an injury they're having, what's the best way to get in touch with you?
They can reach us at our office here at Oak Orthopedics, right across from the Beckman Institute on University, right near Provena Covenant Medical Center, or at oakortho.com. I'll be happy to talk to them or see them for any of the issues.
All right, Dr. Scott Paluska with Oak Orthopedics. Thanks a lot for the time, Doctor, and we'll talk to you again next month.
My pleasure. We'll see you in February.
All right, Dr. Scott Paluska, Oak Orthopedics, my guest this afternoon. 21 degrees at 429. We've got local news coming up next.